Hello everyone, I'm Khwaja Akhtar, a PGY2 in Internal Medicine at OUHSC. I'll be briefly talking about our research project, which is comparison of transcatheter aortic valve replacement between trileaflet aortic stenosis and bicuspid aortic stenosis, and it's a meta-analysis and systematic review. This is a list of the authors, and the faculty mentors were Dr. Thala Rusan and Dr. Bo Hawkins. A brief introduction. Transcatheter aortic valve replacement has evolved from a novel technology to an established therapy for patients with severe symptomatic aortic valve stenosis. However, the published clinical trials, which evaluated the clinical outcomes of TAVR, had excluded patients with bicuspid aortic stenosis. So, in our research project, we have systematically reviewed the current evidence on clinical outcomes of TAVRs in patients with bicuspid aortic stenosis in comparison to patients with trileaflet aortic stenosis. The search was performed by two independent researchers on 10th of September 2019, and the search was performed in PubMed and Ovid with the keywords of TAVR, tricuspid stenosis, bicuspid stenosis, TAS, and BAS. 361 studies were evaluated, and after removal of abstracts and review articles, 35 full-length articles were assessed, which led to selection of 19 observational studies in the final analysis. Review Manager was used for statistical analysis, and a Mantel-Haenszel random effects model was used to calculate pooled odds ratio for endpoints. The results of our study are reported as odds ratio, 95% confidence interval, and p-values. Here is Prisma flow diagram of our meta-analysis, which shows selection of 19 studies in the final meta-analysis. This table briefly shows the baseline characteristics of the patients, and we can see that all these studies were similar in regards to patients' age, surgical risk scores, and burden of comorbidities. So the total patient population was 12,125, and the patients with bicuspid aortic stenosis were 4,050, and the patients with trileaflet aortic stenosis were 8,075. Clinical outcomes. TAVR in patients with trileaflet aortic stenosis as compared to bicuspid aortic stenosis showed statistically significant increase in following: paravalvular leak, stroke, conversion to surgery, and risk of permanent pacemaker implantation, and all the p-values were less than 0.05. And in comparison of TAVR in trileaflet aortic stenosis and bicuspid aortic stenosis, there was no statistically significant difference in all-cause mortality at 30 days, all-cause mortality at 1 year, and the risk of myocardial infarction. So with this analysis, we can safely conclude that TAVR appears to be safe and effective procedure for patients with bicuspid aortic stenosis as well as patients with trileaflet aortic stenosis. It can be offered to patients with bicuspid aortic stenosis as clinical outcomes are similar and in some cases better than patients with trileaflet aortic stenosis. We need further randomized clinical trials to assess safety and feasibility of TAVR in patients with bicuspid aortic stenosis. Here is the list of our references, and any questions can be directed towards my email. I thank you all for your listening.